Dear televiewers, you are all welcomed to your most favorite channel, Talk to Bonnie. I will be talking something this morning that is very common, something that can easily occur in the lives or in the bodies of people living with diabetes, which sometimes we are not aware about or talk very little about. Do you know that when somebody is living with diabetes, the person has an increased risk of developing some kinds of cancers? And what are some of these cancers that can easily occur in the bodies of these people? Or cancers that these people are at risk of developing? You have cancer of the liver, cancer of the pancreas, cancer of the colon or the rectum, what we can call colorectal cancer, cancer of the endometrium. The endometrium is the lining of the womb, the uterus, the area where the baby usually develops or grows. Breast cancer, and also cancer of the bladder, that area of the body which usually stores urine before you pass it out. Why is the risk high in these persons? Three major reasons. Because the amount of sugar circulating in their bloodstream is higher than what is supposed to be. Most of these people usually have large amounts of insulin circulating in their bloodstream. Insulin, remember, is the hormone that the pancreas produces, or the chemical that the pancreas produces, that causes the glucose circulating in the bloodstream to enter inside the body cells where it can be used later on. Or this person, and lastly, these persons usually often have inflammation occurring in their bodies. You know, inflammation is a response of a body part to injury or when some germs penetrate. And people living with diabetes often have many things happening in their bodies that can lead to this inflammatory response occurring. These are some of the major things that can happen in the bodies of people living with diabetes that will increase that, or that can increase their risk to develop cancers. And so what are we saying? If somebody has been diagnosed to be living already with diabetes, we encourage you to regularly visit your healthcare provider to have yourself checked so that some of these things don't occur. Secondly, maintain the advice that your healthcare provider gives you strictly. This will help to reduce your risk. What then of those who may be living with diabetes who are not even aware? I am at this level encouraging people to regularly go to the hospitals that are closest to you or the health facility that's closest to you to have yourself checked to see if you are living with diabetes or not. Remember, studies have shown already that about 80% of people living with diabetes in Cameroon have not yet been diagnosed. And for those persons living in or near in places where we have Cameroon Baptist Convention health services, health facilities, you can visit their know your numbers units or services to have yourself screened. Why is this important? When you visit this service, at the end of the screening, you will receive information that will not only help you to prevent diabetes, but many other non-communicable diseases. So those persons in facilities in localities that have the CBC, HS, health facilities, you are encouraged to go there to have yourselves screened. Encourage your loved ones to have themselves screened in these facilities or any other health facility that is within their reach. When we do this, it will greatly help to reduce our risk of developing some of these conditions so that you and I can stay healthy on this planet to do the work God created us to do. What is my last word? Comments, share, and like this video so that many others can benefit from what you've just gotten now. And share this information so that other lives can be saved. Thank you so much.